guys, Lauren Losing here to do my frequently asked questions pre-op plastics edition. I had done what I had thought was a pretty informative pre-op plastics video, and then got some questions after that I was kind of like, oh yeah, I probably should have included that information. So I tried to group these in a pretty logical order, but I think some of them are skipping around a little bit. So I will just start with kind of the basics, I guess. So I am having my surgery with Dr. Amy Colwell out of Massachusetts General Hospital in Boston, Massachusetts. I am from Massachusetts, and so that's where I'm having my surgery. What surgeries am I having? I am having a brachioplasty or an arm lift. I'm also having a mastopexy with augmentation, which is a breast lift with implants. It is going to be one very long incision, so it's gonna like take care of my own like loose skin in my armpit slash over the bra band area. And then my third surgery that I'm having is a belt lipectomy or a 360-degree lower body lift. How did I decide on these surgeries? It's what I knew I wanted. I also, during my consult with the surgeon, asked her opinion, and she said I could do just an extended tummy tuck, but that I would really get the best results from a 360, and that's kind of what I always had in mind. She did ask if I just wanted a lift or if I wanted implants, and I said I wanted both. And she agreed with my decision that if I had just had a lift, which she would have done, but that I would really get the best results with implants as well. I am having silicone implants. She asked me to give her a range, so I said around the 300cc range. The way I picked this out was at my pre-op appointment. I brought a non-padded bra with me, and they had me try implant sizes on in my bra and like put a shirt on. So I'm requesting the 300cc range, no larger than 350 cc's. So basically, using her judgment. Am I having my surgeries all together? Isn't that dangerous? I have the, sorry, I'm quoting questions. I went to a surgeon who wouldn't do those all together, so I don't think that you should do them all together. So my first consult with a different surgeon, he would not do them all together, and he also wouldn't do a 360 because he did not perform them that often. So yes, I am having them all together, and yes, my surgeon feels comfortable doing them all together. She laid it out for me like this. You can do your upper body separate from your lower body if you would like. However, if you would like to get this done all together, you are young enough, you are healthy enough, I feel confident enough doing it all together that we can do this all together. Just know, she made sure that I was going to be having people staying with me after, which my mother is staying home with me as long as she needs to. She's going to be staying home with me until I can safely bring myself to the bathroom. So she said, as long as you know that those first 5 to 7 days are going to be hell, it's not going to be easy, but she feels comfortable doing them all together. So yes, I will say that not every surgeon feels comfortable doing that many surgeries together, and maybe I don't mean this in an insulting way, but maybe you're older than I am. Maybe you have more health concerns than I do. And you know, maybe your surgeon is a plastic surgeon who doesn't specialize in body contouring after massive weight loss. I don't think you need to go see someone who does, but my surgeon does specialize in body contouring after massive weight loss. She does these large procedures together a lot. So that's the reason I chose my surgeon. For people who have asked why I'm not going to see Dr. Katzen in Beverly Hills, why I'm not going to Mexico. I am going to a doctor I don't want to travel for my plastics. I want follow-up care with the same surgeon. If there were complications or an emergency, I want to be able to have my surgeon nearby. I don't want to pay to travel. These are just things that made me decide on my surgeon. My surgeon specializes in the same thing that Dr. Katzen does. So I don't know why I would travel across the country to see Dr. Katzen, pay for travel, pay for a hotel, pay for all that stuff, if I can see someone in my state who does the same thing. My surgeon also specializes in breast reconstruction for like cancer patients, or I was going to say our trauma patients, which I guess you could have trauma to your breast, but so that also makes me very confident in her, because you will never hear me say that I'm having reconstructive surgery, simply because I don't consider me with my body and what I'm having done reconstruction. I consider it plastic surgery. I consider it cosmetic surgery. But the fact that, my breasts are so out of whack and she specializes in that makes me feel good. Let's see. The cost. People don't find this to be a rude question. I find it a little bit rude, but I understand where it's coming from. You want to know this amount of surgery and how much it costs. So because I am having the surgeries done all together, I don't have to pay, I have to pay the anesthesia fee for a longer time, but I don't have to pay it separately. So I don't have to pay like a separate anesthesia fee. I don't have to pay for a separate surgical suite fee and all that kind of stuff. So my surgeries are going to cost $25,375. If I had them quoted separately, it would have been a lot more money. And when I did have them quoted separately from a different surgeon and just for an extended tummy tuck and not even a 360, it was about $34,000. So, yeah, that's the cost. And how I'm paying for it, my surgeon's office does not accept care credit. I know a lot of surgeon's offices do, but my surgeon's office only accepts cash, credit card, and bank check, and so I am paying for this with a loan. Did I ask how much skin would be removed, like in weight? I did not. I'm someone who's trying to have realistic expectations from my plastic surgery. I'm really not interested, I guess, in an estimate of how many pounds will be removed. I will be interested to see what I weigh, after some of the swelling has gone down and stuff like that. And I'm going to ask her after it is removed, how much did the skin weigh, how much fat was removed, because there will be some lipo involved. But my skin is really thin and loose right now that I honestly don't expect that much to be removed with lipo. But, so I will ask after it's done how much was removed, but I really wasn't interested in an estimate before, just because, like I said, I'm trying to kind of like manage my expectations and not have these. I don't want her to tell me that 10 pounds of skin will be removed and then feel disappointed if only 7 pounds of skin is removed, or 5. I don't know. I will say that my breast implants are going to weigh, for the 2 of them, will be weighing in at about 1.5 pounds. So I will be adding about 1.5 pounds to my body and then removing however much else. I will be staying in the hospital for 1 night. I will be specifically staying on a plastic surgery inpatient unit. It's really just to monitor after the anesthesia. You really don't want to stay in the hospital for any longer than you have to, just due to hospital-acquired infections. And that is my biggest fear post-op, is to have a complication or infection, specifically MRSA. So I am happy that I'm only staying in the hospital for one night. I will be coming home. I will be using a medical recliner. I didn't think I needed one, and then I went to WSFA and talked to everyone I could who had already had plastics, and they said if you can get a medical recliner that, you know, stands you up, absolutely do it. So I will be staying in one of those in my living room. I will be having between 6 and 8 what are called JP drains. So I'll be having 4 on the bottom and either 1 on each side or 2 on each side on the top. I am taking 8 weeks off from work, and that is simply because of the nature of work that I do. I'm a nurse. I need to be able to perform CPR in the case of an emergency. I am a psychiatric nurse. I need to be able to restrain people if necessary. And so I can't go back to work light duty. I'm not going back to a desk job. I think if I was, I'm not exactly sure how much time, but I am taking a full 8 weeks off because I need to be able to go back to work and perform everything that I just stated. And I think the last question is a skin flick. Am I going to be doing a skin flick? Yes. I do have a skin flick from when I was 1 year post-op, but I am thinner than I was then, and my skin is actually worse. So many people said to wait for plastics because actually I might have some, like, your skin might rebound a little bit, and my skin looks worse now. So I am glad that I waited. I am glad that I'm having it when I'm having it. It's just the right time for me. And I am glad that I have lost some more weight so that my skin is even looser, and hopefully they can pull it even tighter. So yeah, the day before my plastics is when I will be doing my skin flick. That's also when I'm going to be doing, I'm going to do it all in one video. I'm going to be doing, you know, my day before plastics kind of feels video. So if there are any questions that I did not cover in this video that you would like to know pre-op plastics, you can leave them below and I will try to cover them then. I will be doing my week, whatever, 140 something post-op VSG / after WSFA / 1 week pre-plastics video tomorrow. So until next time.